get started. So our session today is with Dr. Rosemary Kohr, and we're going to do a Q&A. So let me just go through a quick agenda with everyone. We're going to do a Q&A with Dr. Kohr, and overall welcome here to this session with the Canadian Healthcare Education Network. We are a postgraduate professional learning school focused on healthcare. And most of our students are healthcare professionals, nurses and allied health professionals, as well as healthcare staff and leadership. But this session today is really focused on wound care. And of course, attendees may include professional staff and as well as leadership. Let me just admit that person. So we have focused on directing questions to Dr. Kohr that we feel are most relevant to you, what you need to hear about as it relates to taking wound care education, and maybe starting to demystify how to make a really good choice when it comes to selecting the wound care education you feel is right for you, for your practice, for the organization you work in, for your career as well, if it involves career advancement that you're looking for around wound care. So we've got a number of questions that I'm going to direct to Dr. Kohr today, trying to get at some information for you to take away with you. Then we're going to go over some information about wound care programs that we run here in CHEN and answer questions about them. And we're going to give you an opportunity to field some questions to Dr. Kohr that you may have, whether it's about a course or about something you're thinking about relating to your own career development related to wound care. So let's get started. I'm just going to stop my share here. And we're going to field some questions. But first, let me introduce you to Dr. Kohr, because many of you who may be on the line perhaps are not familiar with her. If you are, please bear with me. So Dr. Kohr is a wound care educator and author and founder and founding director of the Canadian Healthcare Education Network here, CHEN. And she's also the author of the Skin and Wound Care chapter in the Canadian edition of Potter and Perry's Fundamentals of Nursing and the Elsevier Nursing Skills textbook. And she helped develop the curriculum for the Master of Clinical Science in Wound Healing at Western University. Dr. Kohr has spent decades advancing evidence-informed nursing and wound care education across Canada. She holds a BA in Visual Arts from the University of Ottawa, her BSCN's from Laurentian, her MSCN and Tertiary Care Nurse Practitioner Certificate are from Western University, with a PhD from the University of Alberta. And for over a decade, Dr. Kohr was the program director for the Wound Care and the Patient Navigation Program at York University, known as HLN, Health Leadership and Learning Network, and she also taught in the Master of Nursing programs at both Western and Athabasca. Dr. Kohr is bringing a really depth of knowledge, rich experience in wound care, education, and clinical practice. So I'm going to dive right into some questions. Okay. So Rosemary, you've spent decades working with clinicians across Canada, as we can see, and I know personally. What's the biggest misconception that nurses have about why they may be struggling with wound care?
And that's a great question. I think the biggest misconception is that a wound is a wound is a wound. And I'll talk a little bit more about that later. But underlying that is that clinicians think that their uncertainty means that they're somehow not good enough clinically. And that's just not true. I meet incredibly intelligent, compassionate nurses, therapists, physicians, frontline people every day who feel anxious when they're dealing with wounds, not necessarily overtly, but inside, this is what they're thinking. And part of the reason for that is because wound care is often taught in very fragmented way rather than as a true clinical reasoning process. So clinicians are taught the task. They're taught dressing changes, product names, protocols, but not necessarily the why behind what's happening in the wound itself. And when you don't understand those underlying principles of wound healing, then every wound starts to feel unpredictable, or predictable, which is when problems happen. So people blame themselves, why am I not confident? Why do I still feel unsure after all these years? But often the real issue is that they were never given a strong foundation in their education that connects assessment, healing physiology, critical thinking, and treatment decisions together in a meaningful way. And that's what changes confidence, not memorizing products. Yeah.
Okay. Yeah. Yeah. So this sort of this depth of understanding how to critically use the knowledge as opposed to just having a checklist. And there's a big difference between the
Right.
two and in
Right.
practice, and in practice. So I can understand why there could be a level of um, lack of confidence, then in practice. Then, okay, I'm going to complicate this a little bit then. Because clinicians, on top of just treating the wound, clinicians are exposed to endless products. And I've seen all those endless products, rooms full of them. Like endless products, dressings, and wound care pathways. Those charts you may get, reference materials you may get. Why are so many clinicians still feeling confused despite having all that information at their fingertips?
Yeah, well, and there's certainly been a real plethora of pathways, so evidence-informed pathways that, look on paper really great, but the pathways are not the same as learning wound care. So I often use the analogy of baking, not that, I bake much myself, but the thing that I know about baking is that when you have a recipe in front of you, you already know what each of those ingredients can do. So, for example, what's the ingredient you would use to leaven a cake that you're making, or the oil, or the milk, or the water? Why are they needed in the recipe? And always my question is, what do I do if I don't have those particular ingredients? I open the fridge and go, oh dear, I don't have, whatever it is, the eggs that are needed for this. So what do I do? What can I substitute? So dressings are not just the ingredients that you throw onto a wound. And I've seen this time and time again, is that, it's sort of like one dressing meets every need. You really need to understand what each of these dressings does, how they work, why they work, and when they may not work. Companies have spent a lot of time, money, energy on the research and development for these products, and yet we often treat them like they're all the same. So you can't just say, "Oh, this dressing is okay. This is good." Well, good for what wound? At what stage? What kind of drainage does the wound have? What's the underlying cause? What are the patient factors? What are the environmental kind of conditions that people need to pay attention to? So dressings are really important, but they're not the most important thing. They're important only if the clinician understands the principles guiding their use. So, what happens sometimes is that people, they have all these products in front of them before they have the confidence in wound assessment and healing principles. So, that overwhelms people. And what really needs to happen is the clinicians need to understand first the wound. What is the wound telling me? Then the product starts making sense. And the dressing then becomes part of the clinical decision, not the decision itself. And I think that's a really empowering shift for nurses in particular who are providing wound care.
So those dressings, why they are used are part of the solution. You can't separate the two of them. You learn wound
Right,
care, you also must learn about those dressings.
right, right.
Okay. And I've seen this happen even when you have limited access to dressings. You're figuring out how to use them.
Hmm. Oh,
Uh,
absolutely.
yeah.
Yeah,
Even with
yeah.
what you just use what you have. Okay. So I know you've worked with many clinicians as well as many students because I've worked with you for more than a decade. Um, what is something you know about why nurses struggle with wound care that most education providers never talk about? And I'm an education provider of wound care. So I'm really interested in what you think about this question, what your answer will be.
Yeah, that's a really good question. And I think part of the problem is that many clinicians just don't know what to do. And so they kind of use whatever the fallback is. They use the order that was there from a week ago, despite the fact that the wound itself has changed. I always say, no one, everyone does what they do because they want to do the right thing, but they don't always know what the right thing is to do. So it's not because people don't care. I think it's really because wound care and prevention of skin breakdown are not considered critical in the education of healthcare providers. So, most nurses and other clinicians, wound care is a task and a very small part of everything else they need to do for their patient or their client. So, despite the fact that wounds are often the cause of hospitalizations, for example, so, just think about the cause of sepsis. So, sepsis is a major infection that can lead to death, and certainly can lead to, an IC stay in the ICU. The cause of sepsis often is a break in the skin, in the integrity of the skin. So, infection comes through a break in the skin. How do we prevent breaks in skin? These are the things we need to pay attention to. Or amputations. That's another thing as well. The majority of lower limb amputations are related to diabetic foot ulcers that become infected. So, and other sorts of issues relating to diabetes. But the point is that usually when you look at a lower limb amputation, if you kind of go back to seeing how did this happen, often this is related to someone who has had a diabetic foot ulcer that has persisted and then become infected. And this is hugely expensive. All of these are hugely expensive for our already really stretched healthcare system. There's tremendous pressure in healthcare environments today. There are time pressures, certainly staff shortages. We know really clearly that's a problem. High acuity, and including, I have to say, an increase in skin, wound and infection issues related to opioid drug use. So, this is something that we really need to pay attention to. Demands of documentation. If you do something, I mean, it's really important that when you provide care to a client or a patient that you document what you've done. You create a way for other people to follow, to see the evaluation process, et cetera. So, there's a lot going on there. And there are lots of competing priorities as well. But, wound care requires careful observation, critical thinking, pattern recognition also, and confidence in decision making. And, many clinicians have never really had the opportunity to do that, to develop skills like that in a supportive learning environment where they can ask questions, where they can practice clinical reasoning and connect theory to real world patient scenarios. And I have to say, often instruction at colleges and universities for nursing students, the clinicians who are providing that also don't necessarily have the up-to-date evidence-informed information that they really need. So there's a lot of problem in terms of really being able to effectively teach and learn. So, you want to, we recognize that what people end up doing is they compensate for this sort of lack of real knowledge about the topic by relying heavily on routines. This is where you have your order the order that you look at and you say, oh, okay, today is day 3, so I need to change that dressing, despite the fact that maybe the dressing doesn't really need to be changed at that point. So it's, paying attention to what's going on with that particular wound. So people rely on those routines, on the product recommendations or algorithms, but they still don't really feel confident themselves. So I think what changes is when clinicians start to understand and look, what am I seeing? Why is this happening? And my sort of favorite part of this is, what is this wound telling me? What is it telling me right now that it needs? Not last week, but what is it telling me that it really needs? And what are the other components that are unique for that person? And what else needs to be considered? So somebody who has a foot ulcer, who lives in a precarious setting, socially, financially precarious, not only do we need to treat the wound itself, but we need to pay attention to how we can support wound closure. So offloading, control of blood sugars, foot care. What is the environment like that person is living in or going to go back to if they're, say, for example, they're in an acute care setting? And if these things aren't dealt with, that wound won't close. Or if it does, how long will it be until it or another one reappears? As Gary Sibbald has always said, it's not the hole in the person, it's the whole person. And I think that's, when we start to have that knowledge, that's when wound care becomes less intimidating and much more clinically meaningful. And, I think when the outcomes, you can then kind of predict what the outcomes are going to be because you have prevention working and wounds that do develop, close, and don't recur. So that's maybe a long answer, but that's kind of how I see things. Yeah.
But this is the vital key. This is the key. It's what bridges the education, the benefits of the education impacting the outcomes. And it's that it's
Mm-hmm.
not just about what you learn, it's about the student, the practitioner transitioning from a level of just doing it by rote to a level of critical assessment and trust in themselves and that at every step they're able to execute that critical assessment of that wound and use the
Right.
knowledge that they've gained. And it takes a way of teaching it to help them do that. So
Yes.
the key is in the education, in how it's instructed.
Yeah, absolutely.
Yeah, and I, as an educator of like for almost 2 decades of in professional learning, like I completely agree with you on that. It's that transition is key inside of the education. Um, so. Now, I think this question is what we just talked about is a really good lead into this next question. Because it's around a person selecting the right wound care, learning for themselves. So if someone is looking at several wound care programs online, because that's where they're all residing right now, and they're all very similar because they do look really similar. What are the questions they should really be asking? Because you as an educator and as a nurse, as a contributor to the academic system as well as the clinical system, what would you tell them? What
Yeah,
should they
that's,
be
you're
asking?
right. And that's really that's the $1 trillion question. Because, many of these programs look very similar on paper or, online. And there are lots of courses around. Um, I want to pause here a little bit just to point out that there's kind of there's a line, there's kind of a continuum, if you want to look at it kind of like, as a line. Training, education, and learning are all part of that same line. So training is something that gives you information. like safety training, how to lift correctly, how to avoid patient falls, how to insert an IV or apply an ostomy appliance. That's training. You can train people to do that. Education goes beyond that. So educational programs, when they do what they're supposed to do, deliver outcomes-based learning. So the education program should provide a level of understanding about the topic that goes beyond training. It's the why. It's responding to the question, why am I doing this? And in order to effectively, I think, learn wound care and prevention of wounds, I mean, that's, has to be part of that process. It needs to be taught in a way that encourages knowledge intake. And I wrote a paper on this that we have actually on our CHEN, on our platform. I call this sticky learning, which is what we do at CHEN for all our courses. The idea that learning needs to be interactive with lots of opportunity for discussion, reflection, practice with a live educator who is an expert clinician as well as being a skilled educator. Because, you're dealing with people primarily online. I mean, this is kind of how we are providing these programs, not just us, but other organizations as well. So many courses are offered and in many fields that are advertised as self-directed, asynchronous. In other words, do this on your own time. So that's asynchronous. I call this lonely learning because the learning is just interacting essentially with a computer screen. It's just you and the computer, which is fine if it's information-based learning that doesn't require real critical thinking skills. But I believe that for something like skin and wound care, the best option is for live sticky learning that gives, like, it's sort of like, it sticks to you, right? You remember this stuff. It gives the learner an opportunity to ask questions in the moment and have live discussion and feedback, not just with an instructor, but with the other people in the class as well. Because that's, and to me, that's part of the whole notion of network, is that if you want to develop a community of practice, you can do it two different ways. You can set up a community of practice and say, oh, here we have a community of practice, join us. Or you can create a community of practice from the ground up, which is more the approach that we take, to really get people to kind of talk together. And I will say that because this is just an aside, but because we are across the country, we have learners who are from all parts of the country, and they come together, they learn about what's going on in British Columbia or in the Northwest Territories, or Prince Edward Island or Newfoundland. So, it's an opportunity for people to really find out what's going on. Maybe people are doing something that's really interesting and engaging, and it's an opportunity to have those conversations as well. So learning together is far more effective than learning alone. And particularly, the other thing too, I think, particularly given the diversity of learning styles that, we are aware of, that we've worked really hard at CHEN to ensure that learners get what they need in a format that works for them, with not just those live interactive classes, but, handouts and materials, videos, etc. to use. So there's lots of other stuff that they can do. Plus, in our level 1 wound care course, my favorite part, they have a package of dressing samples. Each participant gets a package of dressing samples to play with during the course. And I'll talk about this a little bit more later. But, what I would encourage people to do when they're looking at programs, to decide what they want to invest their money in, is part of it is, who developed the curriculum? And I have a master's in adult learning, particularly nursing, and curriculum development to me, and ensuring that you have the learning outcomes that are relevant to that particular curriculum is really important. There need to be evaluation components. Is it evidence-based? Is it independent? So is it something that is, and there's nothing wrong with sessions because there are lots of them and they're really good sessions that are provided by companies, for example, that, dressing product companies. It's really helpful to have those, but that they're going to be skewed in the direction of their product. I mean, that's just, you just know that. And the other thing, a couple of other things, does it actually develop clinical competency? Or is this just information? Will I be more confident applying this at whatever the bedside is, or in the community, wherever you happen to be working? Are you going to be able to take this with you? Who's teaching it? Do the instructors have real clinical expertise? And is there an opportunity for interaction and discussion? Obviously, I'm skewed in that direction, but can I ask questions? Can I work through real patient scenarios? In our programs, we encourage people to actually come with their case examples to discuss in the class. That as long as they have the consent from the patient to be able to, for example, share photos, and we keep everything very general in terms of no personal information. But and another really important question I think is, does the program help me think clinically, or does it just expose me to products and content? It's that sort of on that line. Where is it? Is it just the sort of training, the information, or is it actually knowledge that I can integrate and use myself? Because there's a huge difference between consuming information and developing competency. I don't think people want just continuing education hours anymore. They want confidence. They want practical skills. And they want to walk into a patient encounter feeling more prepared. And that's what meaningful education should do. Yeah.
Thank you. Thank you for the depth of that. And I'm going to add, just because I've been in this industry for 20 years with wound care, when you see students succeed in level one, for example, when it's live, synchronous learning with an instructor, then you watch them walk to a more intermediate level, like level two wound care, and they succeed as well. They don't struggle. You know that the foundational knowledge was the uptake, it was new acquiring of new knowledge, and it was the uptake was good. The education worked for
Right.
the outcome they were looking at. If they were to struggle in level two, you know that whatever they learned foundationally was not sufficient from an education perspective. The uptake
Right.
was not sufficient.
Right.
So for me, that's the way I always look at it as an educator. It is how they're achieving when they go to the higher level. Like, are they a star or are they struggling? And
Right.
it's always proof. That's always the proof. That's always the proof. And I think
Yeah.
that's seen by the employers as well. I really do. By, say, if it's the DOC or the ADOC, if they're, in a home, or if they're in the front line, if they've got a nurse manager or someone who's supervising them, that's the proof is in the pudding. It's what their employers then see.
Right. Right.
Um, okay,
Yeah,
my
good
last
point.
question for you. Um, so many people who may be on the line today, and maybe listening to this afterwards as well, because we've got it recorded, we're going to put it out there, maybe wondering whether now is the right time to invest in their wound care education, or maybe in the wound care education for their staff. What would you say to the clinician or even to the manager who feels uncertain and overwhelmed by all those options out there, because there's a lot, and worried about making the wrong choice? What would you say to them? Because it is an investment. It's an investment of time, not only money, but of time as well.
Yeah, I think there are two sort of pieces to this, I think. First of all, I would say you're absolutely not alone. I think almost every clinician I meet feels some level of uncertainty with wound care at some point in their career. And as I said, I know that for most people working in healthcare, wound care may not be the full on piece that they're doing. However, it's a really, really important part of what it is that they do. And prevention, skin management, I can't, overestimate how important that is also. And we certainly talk about that. But, wound care knowledge changes everything. It changes things for patients, for outcomes, for confidence. And the other thing, too, is often for career opportunities. People who are working in this environment build strong foundations and then continue learning in meaningful ways. I think that's what's really important. My advice is really don't choose education based only on convenience or price. Choose education that changes how you think clinically. So choose learning that helps you understand the why, not just the what. Because once clinicians truly understand the wound healing principles, wound care becomes far less overwhelming and far more rewarding. And I have to say, I don't think there has ever been a more important time for strong wound care knowledge than right now. I mean, all you have to do is look at the news. All of the issues around people who are unhoused, all of the issues around people who are seniors and vulnerable, people who are who have people with diabetes, people who are orphan patients, who are struggling with the kinds of things that we know can be dealt with in a very effective way when the clinicians have the knowledge, skills that
Mhm.
they really need to have, and that the organizations are supportive of this happening. Yeah.
Yeah.
So I want to, I think that that's what's really important. And I wanted to, now I'd like to be able to look at the courses that we offer through CHEN and also give you some, tantalizing tidbits about what's coming for 2027, because, we're doing that too. So we're seeing yeah, can you show us just the
Yeah,
slide,
I put
the
the
one
rod.
slide?
And I,
Yeah.
I must say there that it's also for considering for your career development too. Just as I'm getting the slides going, if you consider what you're targeting as your career goals, and if they include wound care, perhaps in a big way, selection of those programs is really key. So you can advance to those career goals in a reasonable timeline.
Mhm.
Um, it may include a change of job. Maybe you're upskilling for a new job, and maybe as the wound care specialist. So selection of that education is really key, and you want to get there as quickly as you can, without struggling. Oh,
Or the other thing that happens too is that people are told that they're, it's kind of like, oh, you're the clinical educator now. Oh, you're the wound care champion now. And you're like, great. It's like deer in the headlights. So,
congratulations.
yeah.
Yeah, yeah. I've
So,
heard those stories too from students. I've heard that.
oh yeah, yeah. And we hear that all the time when people are registering for courses. They say, well, I'm the wound care specialist in my long-term care facility. Help.
Help. So
Yeah.
I've brought up wound care level one. Rosemary, if you want to take people through that, and I will
Yeah.
advance the slides. Just let me know.
Yeah, I will. Okay. So at the moment, we have two levels, and you have to take level one in order to take level two. And there is a reason for that. Um, Aside from, important knowledge that you need to develop, one of the other things is that we have a particular approach to assessing a wound and determining which selection of dressings. So not based on companies, but based on generic principles of what what the dressings are, how the dressings work. So this is a program that is designed, it's open, right? It's allied health professionals, newer experienced clinicians, nurses, nurse practitioners, physicians, pharmacists, PT, OT, other people as well. We've had PSWs take this program who are really keen on wound care, recognizing the limitations of your own scope of practice. I mean, that's the other, obviously, that's kind of something that you have to pay attention to. But what we talk about are wound assessment documentation, wound healing principles, the sort of basics of chronic wounds, pressure injuries, and the other kinds of wounds that are chronic wounds, infection, inflammation management. We spend a lot of work on dressing selection, moisture balance, and clinical decision making and referral considerations. So can you go to the next slide? Because I think that's still about level 1. So this is a course, again, these are live, online, virtual via Zoom. So like this setup, and they are full days. So level 1 is full days. And I just put in here the time from Ontario, 10 to 5 p.m. So 10 a.m. to 5 p.m. And we do this because we have people who are from all over the country. So if people are coming on at 10 a.m. Ontario time and they're living in British Columbia, that's 7 a.m. BC time. So it's not, it's not impossible. And Atlantic time, it's 11 o'clock in the morning. So again, it's workable across the country. This is hands-on learning with wound care products and supplies. And actually, I have here. So this is, I don't know if you can see this or not, but there is a package of dressings that every person in the course gets before the course starts. And that's what we use throughout the course. You open everything up with the instructor, with all of the other people in the class as well. So this is interactive case-based learning, because that's how we learn. It's the theory is embedded in what it is that you're learning, but it's not the thing that's on the surface. So it's really practical skills you can use immediately. So yeah, do you want to go on to the next one? So that's level 1. Then level 2 is our advanced level, and it builds on that foundational knowledge. So it's a deeper dive. Essentially, it's a deeper dive into these focused areas with complex wound management. I don't have to read this to you because you can read yourselves, but basically really looking at, continuing that evidence-informed planning, advanced dressings. So talking more about the kind of what's newer on on our availability, and what are the kinds of things that are coming along, because they're definitely all the time, there's new work being done around appropriate products. Oh yes, add your questions. If you have any questions for us, please do. So, it's also really looking at the interdisciplinary approaches. And also, the wound is not your wound. The wound belongs to the patient. So, how do you provide education and motivation for individuals who are experiencing whatever the wound is that they have? How do you get them to be part of the treatment process, because they need to be as well. And it really, this provides enhanced confidence for independent and teamwork also. So independent clinical decision making, but also we're working as a team. How do you talk to the other members of the team? What's the documentation process look like? So next slide, please. So, I forgot to mention, actually, can you just go back to that slide? Sorry. So, this one is, it's 4 half days. So that's the other piece to remember for this one, is that it's 4 half days rather than full days. So the course is, generally speaking, 1 to 4 p.m. Eastern time, so Ontario time. So it's much, there's the time frame is different as well for this course. I just wanted to mention that. So can you just go on? Yeah. So looking ahead to 2027, we are planning on level three. We've been asked about this. People are interested. They have asked us in our evaluations, what about level three? So we are looking at developing, building an innovative opportunity for clinicians who are looking for really advanced, a much deeper advanced practice development that focuses more on wound care leadership and specialty practice. So this isn't necessarily for everybody, but this is something that will be of real benefit to people who kind of are interested in moving forward in their career as wound care clinicians. So I just want to add that in there. And it's coming soon. So that's, yeah. So to learn more and to register for courses, our upcoming course dates are available online. We have courses for the fall and winter coming there. And remember too, there is tuition funding in different
Yeah.
nursing organizations. So, make sure you take a look at that. A lot of nurses don't realize that they have up to $1,500 annually through now it's the RNAO for nurses in Ontario that is the sort of holder of the money, but you don't have to be an RNAO member. I think people they always think, oh, I have to be a member of RNAO. No, you don't. But that's where it's housed. So, and we have a letter if you apply for the funding, we do have a letter that we, can provide you when you are actually applying for the money. Unfortunately, with all of that tuition funding, you have to pay for the course first, and then you apply for the funding after you've completed the course. We have group discounts. We also have Nursing Association discounts for British Columbia, Alberta, Manitoba, and Saskatchewan at this point, and also the community health nurses in interest group in Ontario. We have, so that's a 20% discount if you're a member of the association, and also for all Canadian nursing students, because we realize that this is something that you guys need. And so we offer you a discount with this as well. And we're just in the process. Can I mention this, Tanya, about the bundles?
Yes, yeah, go right ahead.
Okay, so we also have a discount if you purchase a bundle. So a bundle would be level one and level two wound care, or it could be the bundle of level one, level two, and IV infusion therapy, which is another course that we offer as well. So, there's some different ways that you can look at discount possibilities as well. It's flexible live online learning, so you don't have to go anywhere. You receive a certificate of completion, a digital badge. These are all provided. You complete all of the components of the course, and you are present for and participating for every course as well. So you need to have computer, audio, video available as well, to have that accessible so that you can. It's just like being in a classroom, only it's online. So for questions, please contact Andrea, who is our education coordinator at info@CHEN-network.ca, and look at what we have to offer on the website as well. So I think is that basically it,
I think
Tanya?
you've covered everything. I don't see any questions in the chat line, but if anyone wants to put something in, we've got a little bit of time left. If you had any questions about what Rosemary was talking about earlier, in the 5 questions she was answering, about, the how to select that education, what are you looking for? Yeah, I must say I'm biased, as an educator, but I'm not biased. I'm biased, but I'm not. Because I really do know when you are looking at clinical skill sets, and I myself worked with the School of Nursing at York University for many years, and had a basic understanding of the BSCN program, um, it was key, even within the BSCN, that practice, experience, being practical and applied, running simulation, really key to learning those clinical skills. So when you transition into adult learning in that professional learning space after you graduate and you're in practice, it really does not change. So when you see a program that is offered on demand, yes, it may be convenient, but you have to ask yourself that question, is it really the way I should be learning? And think back to your BSCN training. Is that how I, would have learned that clinical skill? Maybe it's IV and infusion. Would I have learned it on demand by reading, or do I really need to
Yeah.
practice it?
Yeah.
You know,
And people, I think one of the
Mhm.
other things too is that I always say like wound care is messy. You walk in
Mhm.
to deal with someone who's got a wound and opening up I always like to say it's like opening a Christmas present. You never know what you're going to get when you take the dressing off. And often that's when I think the sort of single the training piece doesn't really provide the clinician with the ability to think to themselves, okay, what do I really need to be considering here? So how do I clean the wound? How about what's wound hygiene? What does that look like? Because again, these are concepts that we talk about in, school, but they change once you're actually in the real world. And I think that's one of the places where our program is really good because we do have that really, grounded in the clinical reality for people to learn from clinicians who are amazing experts
Mhm.
who have seen, pretty much everything and continue to see everything. So they continue to provide clinical practice themselves, and they're really great educators. They're open. All of our evaluations talk about how open and responsive the educators are to questions that they're asked. And I think that really encourages people to ask questions and to be proactive in terms of their own learning needs as well.
Mhm.
So, I obviously I think these programs are really great, and I think what we're looking at putting together for a level 3 is going to be really important for not everybody, but I think for specific people who are really looking at, I want to be in this kind of role, and I want to have this at a level that is going to provide me with what it is that will be foundational, for that sort of higher level role. Yeah.
Yeah, yeah, and give people a pathway to really get to have a career focused on wound care,
Yeah,
and giving them more options to do that. Yeah. So we're,
absolutely.
we're at 12:50, so we've run out of time. But certainly, if anyone has any questions, please email us. It's at info@chennetwork.ca. It's still up on the screen. Please email us. Whatever comes through the info line, we can direct to Rosemary, or if you have a logistics question, Andrea can help you. But thank you for joining us today. We really appreciate it. Your time, I know it's valuable, and we've recorded it, so it will be available. It's going to be sent out to everyone who signed up for Eventbrite first, and then we'll be posting it to our broader network as well. But thank you. Thanks, everyone. It was really a
Yep.
pleasure
Thanks for
having you
being
here
here,
today.
everybody.
Yeah. And have a great rest of the day. We'll get you back to your day. Take care, everyone.